Again. Hello, welcome again. Dr. Anthony Gonzalez here with Miami Community Health. We're here again with another important health topic. We're in the month of March, and March is Kidney Month, Kidney Awareness Month. We have to focus on the kidneys this month and learn a little bit about the kidneys and why is they're trying to create awareness about the kidneys. So I brought us with us today a kidney specialist, a nephrologist, to talk to us about the kidneys. I want to welcome Dr. Christian Suarez to our program. Welcome, Christian.
Thank you for having me.
All righty. So we're going to talk about the kidneys. So first, tell us about yourself. You're a nephrologist. Is that a kidney expert?
Yeah, well, we treat and diagnose patients that have chronic kidney disease or acute kidney injury or any kidney conditions.
All right. And so one of the confusions a lot of patients have is, what is the difference between a nephrologist and a urologist? And of course, I understand and I know when to send patients to you or send them to my friendly urologist. But explain to our viewers, when should you see a nephrologist and when should you see a urologist? And what is the difference?
So the nephrologist usually diagnoses and also treats conditions that affects functioning of the kidney. In that perspective, the urologists is like a mechanic. Whatever you need to fix, you have a mass, they remove the mass, or have a kidney stone, they remove the kidney stones. So he's the one who performs surgery or also treats and diagnoses diseases as well, but mostly performs surgery on the kidney.
All right. So how common is kidney disease? Why are they trying to create awareness for kidney disease?
So kidney disease is very important. As you look at the CDC statistics, 1 in 7 U.S. Adults have kidney disease. That's really around 15% of Americans. Also, kidney disease is very asymptomatic in the early stages. So 9 in 10 patients that have kidney disease, they don't know they have it. And if you have advanced kidney disease, around 2 out of 5, they don't even know they have the disease. So it's really important that to make this aware, because a simple test or urine test can help you to diagnose. And in addition to that, it's very interesting, like we're in South Florida, so we have a large community of Hispanics. Around 14 to 15% of Hispanic has kidney disease, and a lot of them, they don't know they have it.
Wow. The important thing you said was that the majority of people don't even know they have kidney disease. So before we get into, how do you know if you have kidney disease? And because our viewers want to know, they're listening about kidney awareness. They want to know, hey, do I have a kidney problem? So first, tell us, what does the kidney do for the body?
Okay, so the kidney filters your blood and get rid of excess of waste, water, electrolytes such as potassium, sodium, among others. Also keeps nutrients in the blood, and also creates hormones like estrogen, that's a precursor of hemoglobin, and also the nutritional vitamin D that we eat or take as a supplement makes it in the form of activated form, so that can absorb calcium and phosphorus in the body. So the kidney is very functioning. They have a lot of functions, and it's very important to have it healthy.
So how does a patient know if they have kidney disease?
So again, it's very symptomatic, but if you follow with a primary care physician on a regular basis, it's just a simple blood test. You look a renal panel or a basic metabolic panel. They can show you creatinine, and that gives you a percentage of how the kidneys are working. Usually, when the kidneys are working less than 60% is when you start getting concerned. In addition to that, you can get a simple urinalysis, and you see blood in the urine or protein in the urine. That also suggests that you may have kidney disease, and that's what you start paying attention to.
Now, you already made a comment that, early on in the stages, 9 out of 10 people don't even know that they have kidney disease. But, before I go to my primary doctor, and it may take me a couple weeks to get to my primary doctor, are there any signs that I know that I may have a problem with my kidneys?
Usually when you start having advanced kidney disease, stage 3B, because stage 3 is a big category, but after late stages like stage 4, stage 5, some patients might have nausea, vomiting, very weak, general weakness, fatigue. You start swelling of your legs as well. In very advanced stages of kidney disease, some people will have new onset high blood pressure or worsening high blood pressure, worsening lower extremity edema. In addition, you may have some anemia as well that you can see in other blood tests as well. So generally speaking, when you have advanced kidney disease, when you start having symptoms, and that's unfortunately that we don't have. It's not your heart disease, you get chest pains, right? This is just like very symptomatic, and when you start having late stages, when you start having symptoms.
Right. So I think the important thing is to go to your doctor,
Yeah.
right? Go to your doctor to be checked,
Yeah.
to have it picked up before you get to those symptoms, not wait until those
Yeah,
symptoms.
we also, you, for example, you're young patient, you have sudden onset lower extremity edema, for example, like you're swelling, and you don't know what it is. Like just need to check yourself, because that could be a sign that your kidneys are failing. Just simple as
If you have swelling in your legs and
Yeah.
you're a young patient, then that's a worrisome sign.
the worrisome sign. Yeah.
Wow. Okay. So who's at risk of having kidney disease? Is it the men? Is it the women? Is it the young? Is it the old? Who's at risk?
Actually, women's a little bit more higher risk around than men, but usually number one cause of kidney disease is diabetes. Diabetes is in the rise. Around 11 to 13% of the U.S. adult has diabetes these days. So if you had diabetes, 1/3 of diabetes patients had kidney disease. So that's around 33% of patients with diabetes will have kidney disease. So it's really important to check yourself if you have diabetes. The second most common cause of kidney disease is high blood pressure. As we know, around 50% of US adults after the age of 50, they have high blood pressure. So you have fully controlled hypertension, or you don't know you have a high blood pressure, so you could have kidney disease. And also, you have kidney disease that you don't get controlled, you can have worsening kidney disease over time.
Right. And so you mentioned high blood pressure. High blood pressure worsens kidney disease or causes kidney disease.
Yes.
But also kidney disease can cause high blood pressure as well,
Correct.
right?
That's correct, yeah.
And so is that, explain to us, is it the chicken or the egg? Which one is it?
Yeah, the most common is to have high blood pressure first, and then you don't get treated, or you don't know you have high blood pressure. No, you just see people walking around with blood pressures are 180, 200 systolic, and when they years pass and and just check yourself, and well, you have kidney disease. So most likely those patients has elevated blood pressure for a very long time, and they didn't know about it, so and develop kidney disease. So, but if you do have kidney disease, can also lead to high blood pressure. So it just sometimes hard to see which one came first, but both they're attached, and they need to be checked individually.
So what I've heard over and over from you is definitely see your doctor, right? Because you got to see your primary physician, get your kidney test, your creatinine, your BUN creatinine. Make sure you don't have high blood pressure that's untreated, diabetes that's untreated, and obviously check your blood levels. Now, are there risk factors? In other words, are there social habits that will increase your kidney disease or chance? I mean, I've heard so many times on my show, smoking is not good for you. Sun exposure is not good for you for sun cancer. You know, are there any environmental or social risk factors that increase your chance of kidney disease?
Yeah, obesity is the big one. Obesity.
So
eating disorders. I mean, having obesity increases the risk of kidney disease. Also increases the risk of high blood pressure, diabetes, etc. High cholesterol. Smoking for sure is not good for the kidneys and can cause also atherosclerosis in the renal arteries, which they supply blood flow to the kidneys to keep them healthy. One other thing that we need to pay attention is your family history. Okay, we have, for example, diseases named adult polycystic kidney disease is when your kidneys start having cysts. And you have more cyst formation over time, and it's a genetic disorder. So you know that your family member has kidney disease or being dialysis, it's important to just do a quick renal ultrasound, and they can tell you. Other diseases like lupus, for example, lupus also can lead to kidney disease as well.
So there's some familial aspects as well.
Yeah.
I thought it was only with the cardiac disease or maybe breast cancer, but also even in kidney disease, there's a familial trait as well. All right. So I go to my doctor's office, I get my blood test, and my doctor tells me, yeah, you know what? You have some kidney disease, and you're going to go see Dr. Suarez, our nephrologist. What stages are there in kidney disease? And immediately, are you going to ask me to have a kidney transplant because I have kidney disease? You know, what happens?
Yeah, we have 5 stages of kidney disease. Usually you start pay attention when you have stage 3 kidney disease. So stage 3, for example, is when the kidneys are working around 59% to 30%. That's very wide range, but we divide it between two, stage 3A or stage 3B. 3B obviously is more advanced. Stage 4 kidney disease is when the kidneys are working around 29% to 16%, and chronic kidney disease stage 5 is when the kidneys are working less than 15%. And it's important to know because when you identify those patients, for example, you have chronic kidney stage 3, okay, you know you have it, so we need to start modifying risk factors. So you have diabetes, let's control diabetes, you have blood pressure, let's treat your high blood pressure, etc., etc. If you have chronic kidney stage 4, more advanced, so when the kidneys are working less than 20%, a lot of the patients are may need dialysis, or they can be also evaluated for kidney transplantation. Okay, and I mean kidney transplantation is about time. So if your kidneys are working less than 10%, you can be on the list and start getting. You might not need it at the time, but it's important to be referred and be on the list because you can start gaining time. And a lot of patients they don't know that because you start dialysis is when the first step that you be on the list as in the list in the waiting list. Instead of you start working up your transplant when your kidneys are working less than 20%, you can start gaining time because that can take a year or two before you go to dialysis. In addition, so you have a stage 4 kidney disease, you might need to start talking with your nephrologist to start the preparation for dialysis. Why? Because you might need a fistula. Okay, you need education about dialysis. You need to make arrangements. You work, right? You do have family. You travel. So those little things need to be pay attention because you need to be educated. You need to be prepared. You need to be emotionally prepared to get to that point. So it's important when you have this stage of kidney disease, just to prepare also to do lifestyle modification or control your diabetes, et cetera, to delay also progression of the disease.
And then you didn't mention 5. What's stage 5?
Stage 5 usually when your kidneys, as I said, like less than 15%, those patients are approaching initiation of dialysis. Okay?
So you could be in dialysis in stage 4 or in stage 5.
Stage 5. You start preparing patients stage 4 when the kidneys are working less than 20%.
So 5 is when it's dialysis.
5, 15 or less when you start talking about initiation of dialysis. And that's depending on the symptom or the patient has is when we decide to start.
Right. And we're going to get into dialysis because this is a question I get asked all the time as a surgeon. I'm gonna get into that. But tell us about dialysis. What is dialysis and who needs dialysis?
Yeah. So dialysis is the machine that cleans the blood, that filters your blood and gets rid of excess of water, excess of salt, excess of potassium, for example, and toxins. So if you don't have healthy kidneys, so you don't filtering, so you start keeping all this waste in your blood. So that's why the patients are feeling weak, feeling fatigued, they don't feel well. And that's when dialysis has to be started.
And so dialysis, sometimes patients in the hospital, you know me as a surgeon, I take care of patients, and sometimes they go into what we call acute kidney injury, right? AKI. And they need dialysis. And family members are very scared. They don't want to put their family on dialysis because they think that now they're going to need dialysis for the rest of their life. Can you explain to us that obviously that's not the case, right? You put them on dialysis, you, I guess, bridged them, and then their kidneys come back. Explain to the public about those type of kidney injuries when their family is very sick at the hospital because of a heart attack, because of a perforated bowel, and they need dialysis because of AKI. Explain that and how that doesn't mean that you're going to need dialysis and need a transplant.
Yeah, correct. I mean, many patients in the hospital, they are at risk of having acute kidney injury, okay? And when you're very sick in the intensive care unit, or you have severe heart disease, or you have a perforated bowel, so there's a lot of inflammatory markers, your blood pressure goes low, you might need medication to support your blood pressure, and that puts you at risk of having worsening kidney function. And this is very different of chronic kidney disease because many patients that may start dialysis in the hospital, they might recover kidney function over time. So sometimes the kidney takes around 3 months to recover after initiation of dialysis in the hospital. So it doesn't mean that you start dialysis in the hospital, you'll be on dialysis for the rest of your life. Some patients may be on dialysis after the hospitalization or being sick, but many of them recover kidney functions. So that's the difference between dialysis in the hospital or dialysis in the outpatient of the office area. So this is the difference between them.
So now let's go back to the patient who's in your office and you're following them for years. They're in stage 3, they're in stage 4, and they're getting ready for dialysis. You know, when does somebody need to start dialysis? Should you start dialysis sooner, later? Should you wait? You know, some people obviously may have been seeing their nephrologist and they're like, they're uneasy. Maybe the nephrologist is giving them ideas of maybe starting their dialysis sooner, and then maybe they don't want to be on it. Explain to us, when should you be starting dialysis?
So you need to be with a kidney function less than 15% and having symptoms of having symptoms such as you feel weak, fatigue, nausea, poor appetite, itchy skin, bad taste, swelling of your legs, or in the blood that you have a high potassium that you cannot control with medications or diet. Those are the factors that we take in consideration to start dialysis. So we have different dialysis modalities these days.
Yeah, that's what I was going to. So let's talk about the different
yeah,
types of dialysis.
yeah. We have three different modalities, right? The most common one is in-center hemodialysis. It's when a patient goes to a unit, a dialysis center, and gets placed on the machine between 3 to 4 hours, okay? And is usually 3 times a week, okay? And you have different shifts. You can go first, second shift, depending on your schedule, et cetera, et cetera. We have 2 home dialysis modalities, okay? And that's becoming more common these days because we have seen more younger people on dialysis this day, and you have to work or you have a busy schedule. There's a very common dialysis to use because if you work, for example, you work in the morning, you can go home in the afternoon and you do your own dialysis. And we have 2 dialysis modalities. We have home hemodialysis, which is they send you a small machine to your house, and then you get dialysis between 2 to 3 hours, around 4 to 6 days a week. Or you could do peritoneal dialysis, which is usually 7 days a week. The peritoneal dialysis usually gets performed through a catheter. You place in the abdomen. You guys place those catheters, and the treatment lasts between 6 to 8 hours a day. Usually, patients performs the procedure at night because they have a busy schedule. They have a job. They have a family to take care of. So before they go to bed, they connect themselves. They sleep. In the morning, they disconnect themselves, and pretty much that's it.
So let's concentrate on a little bit on the hemodialysis. You mentioned home hemodialysis. I mean, this is new for me. Do they cannulate their own fistulas?
Yeah, you have 2 options. You do via fistula or you do via catheter.
Right.
Fistula is the preferred mode because catheter is just temporary.
Right.
I mean, you can have it for a long time too, but you don't want to have those for a very long time,
right,
because they can get infected, and you don't want that.
So we trust the patient to catheterize their own fistula.
Yeah, they will get teach. They learn how to do it.
Wow.
They get a course, and when they feel ready to start the treatment, there's somebody watching. They're cannulating themselves, and they do a little buttonhole. So they tell you where to go, and the patient cannulates themselves every time the same place. And we have a lot of patients that are doing this self, and it's been very good.
All right, so the hemodialysis, you're connecting these catheters to veins and arteries in your arm, which is this fistula. Now, in peritoneal dialysis, explain to us a little bit about it. I know what it is, but explain to our lay public what happens in peritoneal dialysis, because that doesn't go into an artery or a vein.
Yeah. So we have in the abdomen we have the peritoneal membrane, and the membrane is like a filter. And the membrane is full of blood vessels. And when you do peritoneal dialysis, as I said before, you place a peritoneal catheter, and we infuse volume, like 2 liters of volume to the belly. The volume stays there around roughly an hour and a half, 2 hours. They sits there, and they use it. We have those fluids that we put in. We have glucose, we have electrolytes, and that's being used to pull the sick blood in that fluid. That fluid has a highly concentrated glucose as well. So the glucose, as a passive distribution, move fluid from one side of the other. So the belly is like a filter, literally, and you can remove waste and remove fluid and electrolytes just with the volume infused to your abdomen.
Wow. And so, is dialysis a good thing or a bad thing?
Well, a lot of people will say, "Are you going to be in dialysis? Are you going to be hooked up to a machine for the rest of my life?" And that's being considered a bad thing. But I think dialysis, in some perspective, is a bridge for kidney transplantation. Okay, so if you're maybe 75 years old or younger, and you have a good heart and good family support, etc., you should be considered for kidney transplantation. And I think it's a bridge for kidney transplantation. It's very important, and also you don't dialysis, you technically you're gonna have a miserable life because I mean you're gonna be feeling sick and tired all the time. Uh, so, but that gives you opportunity to live, no, to
Yeah.
keep
Keeps you alive.
keep enjoying life. I have
Yeah.
patients that travel. They travel overseas. They travel to, I mean, South America, Europe, and they coordinate dialysis in those places. So they can still traveling. We have cruises now with dialysis, and so a lot of people can still enjoy life and on dialysis, especially all the 90 years old on dialysis these days. And some of them they don't do well, but some of them they're pretty good. And they know I want to keep living because of my grandkids, my family, and that's what I see it as a good thing. You know?
All right. Well, no, I think it's a good thing because it's going to keep you alive. And without dialysis, you're going to end up dying if you don't do something.
Yeah.
Okay. And you made a comment that that's a bridge to kidney transplant. And that's what I wanted to get to now as we're beginning to close. So does everybody who has, let's say, stage 4, stage 5 kidney disease needs a kidney transplant? Should everybody get to a kidney transplant?
Yeah, I mean, if you look at the CDC statistics, around 600,000 patients are on the transplant list, and 100,000 get transplanted every year. Okay, but more patients are coming in the list, so it's really
The
hard.
list is growing?
It's growing and growing every
So we're
year.
not catching up.
Not catching up. And we have two types of kidney transplant. Or we have a disease donor, with a patient who died in a car accident or died in any reason, you know, and they decide to donate their organs. And those patients who die or pass away, they have two kidneys, so they can donate for two persons, to two patients on dialysis. But we have living donor kidney transplantation, and that's the fastest, a quick and way to do a kidney transplant. For example, you're in the waiting list. It can take here in Miami, for example, 3 to 5 years to get you to a deceased donor kidney transplant. In the other hand, you have a family member, a significant other, or a friend that are willing to donate. You can get transplanted within 3 months, 4 months, as quick as that. And kidney transplant is very safe, especially for donors. I get that question asked all the time, like if kidney donation is good. I mean, a lot of patients are born with only one kidney and they do well. And the data, I mean, these are data for many years. It seems like patients that donate kidneys are very healthy. Like less than 1% of the kidney donors develop kidney disease over time. And I think because patients are aware they donate a kidney and they don't want to be in dialysis or they don't want dialysis, they keep themselves very healthy.
Wow, that's good to hear. That's
Yeah.
good to hear. So, and I remember from my days 25, 30 years ago when I was at Jackson and did transplant, the living donor is a better donor, right?
Yeah, it's better. It's better because you know the quality, you know who's giving to you. You can also match the blood type very well, and it's faster. And for example, your kidneys are working less than 20%. You can get a kidney with less than 20%. We call it preemptive kidney transplantation. Preemptive means before you start dialysis, and that's the best prognosis. You get a donor, you get a kidney before you start dialysis. That's very important. And the patient that need dialysis, a lot of them are candidates. You're less than 75 years old. You got a healthy heart. I mean, good quality life and no very little risk factors. Those can be a candidate for kidney transplant. So I will say many patients are candidates.
So it looks like almost anybody can help a kidney patient. Now we're talking about kidney awareness in March, and you could be a donor. Like in other words, you can designate yourself a donor because God forbid you're involved in a fatal car accident, a major brain injury, you can donate. If you have a family member, a brother or somebody, you can be a living donor. So everybody can really help in regard to kidney transplantation.
Yeah. We have donors that they put themselves on the list because they just wanted to donate to a random person. Sometimes they don't even know who they're donating. They just want to donate. But a lot of people, they don't. I mean, you know, when you get your driver's license, right? They ask you want to donate or no. So many people, they don't put themselves as donors.
Yeah, they don't know. They're worried. I think a lot of people, there's a misconception that if you put it as a donor, they won't save your life because they're concerned. They're concerned that they just want to let me die so that I can become a donor. But that's not the case. You know, it's not the case at all. All right, so we've learned quite a bit. I think what I've learned the most is that kidney disease doesn't have a symptom like heart pain, chest pain, or like you feel a breast mass in breast cancer, that you have to see your doctor to kind of diagnose kidney disease. And obviously, we've learned that, it's besides obesity and avoiding diabetes and high blood pressure, there's not a lot of other things that we could do to kind of prevent it. Now, how can I prevent kidney disease? Thank God I just went to see my doctor, in February last month, had my checkup. My creatinine is perfect. I don't have high blood pressure. How can I prevent kidney disease in the future? Are there things that I can do, medications I can take, or anything else to prevent kidney disease?
Yeah, I mean, again, lifestyle modification is very important. Healthy eating. I mean, you don't eat healthy or you're becoming obese, that put you at risk of kidney disease. I mean, try not to develop diabetes over time. Check your blood pressure regularly, because sometimes you're walking around with high blood pressure, you don't know you have it, and when you know it's too late and you already had the disease. And if you do have diabetes, we can also delay the progression of the disease. So you need to keep the hemoglobin A1C less than 7. So we have many therapies now, many medications that can be used to treat diabetes. High blood pressure, we have many medications to treat high blood pressure. So the goal blood pressure, for example, needs to be at least 130/80 to prevent kidney disease. And I get this question asked all the time: how much water should I drink?
Oh, yeah.
I mean, you have to drink. I see people drinking a gallon of water or 2 gallons of water a day. I think there's no the right answer for that. We have a thirst center, right? And the thirst center tells you when you need water, So roughly speaking, I think 2 liters of water a day is enough. If the thirst center asks you or tells you I need to drink water, that's when you start drinking more, or your physical activity is more important, or in the summer where it gets really hot. Here in Miami, so it's when you choose to drink a little more water. But water intake is important to not deplete yourself, but overdoing it also could be a problem. Okay, we see a patient with low sodium level because 3 gallons of water a day, and that's sometimes not good. So it's very important to pay attention to those. Low salt diet is very important. We in the Western hemisphere, we eat with a lot of salt. So try to decrease the consumption of salt, because that can also lead to high blood pressure and other diseases. So very important to do those things.
Well, no, we've learned quite a bit today, and thank you, Christian, for coming. Thank you. We've had our nephrologist specialist talking to us about kidney disease. We've learned about seeing your primary doctor, taking control of your blood pressure and your diabetes if you have it. Drink plenty of fluids, and obviously those lifestyle activities that are not good for you, like smoking and so forth, eliminate those, because that's going to make your kidney disease worse, or it's going to make you have kidney disease. So, of course, March is Kidney Awareness Month. Be aware of your kidneys. Always be checked. Thank you, Christian, for joining us today.
Thank you.
Thank you for all the information. And once again, Dr. Anthony Gonzalez here with Miami Community Health, reminding you to be healthy, taking care of yourself and your